In a country of 1.4 billion people, mental health is the silent epidemic affecting millions. Mental health is affecting millions, but often it is unnoticed and untreated. In this video, we will be discussing about what is mental health and why we are struggling to address it. Hi everybody, my name is Samesh Rajpal and welcome back to my YouTube channel where we help you to take control of your financial future and mental well-being. In this video, we will be discussing about India's hidden mental health crisis and what can we do to solve it. If you like these kind of videos and are new to our channel, kindly consider hitting that subscribe button and liking the video as it helps with optimizing the algorithm. First, let us address what exactly is mental health. Mental health, as defined by World Health Organization, is not just the absence of mental disorders. It's a state of well-being where every individual realizes their potential, can cope up with the normal stress of life, work productively, and is able to contribute to their community. Basically, it is how we feel, think, and act. What do you think is the barrier to mental health care in India? Type your answers in the comment section down below. Now, let's move on to why is mental health often neglected in India? Just like physical health, mental health is critical at every stage of life, from childhood and adolescence through adulthood. But in India, it is often neglected. Let me tell you a story of three individuals. The first one was a working professional, other one was a student, and the last one was a retired professional. The 30-year-old working professional was working hard and long hours, often suffered from anxiety, but is afraid to talk about his issues because he believes it would hurt his career. 18 years old student was overwhelmed with exam stress, often suffered from panic attacks, but didn't seek out for any help because he believes it would make him look weak. The last one was a 60-year-old retired working professional living alone, suffering from depression. His community dismissed it by saying old age blues. These are not just individual stories, they represent millions of Indians every day. In India, nearly 200 million people suffer from mental health disorders, yet less than 15% of them receive the help they require. Shockingly, India has one of the highest suicide rates in the world, especially among youth of age 15 to 29 years of age. But why is this really happening? Here are three major reasons for that. Number one, stigma and lack of awareness. Mental illness is often seen as personal weakness or even a curse. Many people avoid seeking help because of the fear of judgment. कि लोग क्या कहेंगे? As actress Deepika Padukone, who bravely spoke about her battle with depression, said, "People suffering from mental illness need support and understanding, not judgment." Her story has helped many understand that mental illness can affect anyone. Number two, shortage of professionals. India has only 0.75 psychiatrists to look after 1 lakh people. That is, for 1 lakh people, there is only 0.75 psychiatrists to look after them. Whereas global average is 3 professionals per 1 lakh of population. This means even if people are willing to take help, still they will not be able to access it. Number 3, policy gaps and ineffective implementation. The Mental Health Care Act 2017 promises mental health care as a right to every individual. But ineffective implementation means people are not aware of their rights. There is a huge gap between what's on paper and what is happening on grounds. That is, the ground reality is much more different than what is on paper. Lack of awareness and implementation gaps are leading to tragic consequences like rising suicide rates and untreated mental illnesses. What do you think is the barrier to mental health care in India? Type your answers in the comment section down below. Now let's break down why mental health is often neglected in India. Stigma and social beliefs. Mental health is still a taboo in many parts of India. People often view mental illness as a personal failure or a spiritual curse. This stigma prevents people from seeking help, and often those who do are ridiculed or ostracized. Economic and social barriers. Treatment is often not just inaccessible but expensive as well. The cost of a therapy can range from rupees 500 to 3000, which for mostly people in rural areas is unaffordable. People fear losing jobs, social standing, or even family support if they talk about their struggles. Systemic issues. Many government initiatives like mental health care program aims to address these problems, but often they are underfunded and lack widespread implementation. Many primary healthcare centers lack professionals and resources which can provide adequate care. It's clear that mental health care in India faces multiple barriers. But what can be done to tackle this situation? Solving this crisis requires actions on multiple fronts. Here are three key solutions that could make a difference. Number one, education and awareness. We need to start teaching mental and emotional well-being courses in our schools and colleges as to bring awareness and reduce the stigma. I also believe that financial literacy courses are also needed to be built into our education system so that children are able to take care of their mental and emotional well-being throughout their life and seek out for a support if they need. And once they start earning, they will also be able to manage their money well. Number two, digital platforms. Online platforms like Your Dost and Vyasa are bridging the gap by providing affordable and anonymous counseling services. These are crucial for reaching people in remote areas and those who fear stigma. Number three, policy and infrastructure. Government needs to increase funding for mental health care programs and ensure better implementation. We need more mental health care professionals, improved facilities, and proper monitoring. But this change needs support from all of us. It's time to take mental health care seriously. We all need to work together to build ourselves a better future. What do you think is the most effective solution for improving mental health care in India? Comment your answers down below. If you or someone you know is struggling, here are three steps you can take right now. Number one, practice self care. Simple activities like daily meditation, exercise, or journaling can make huge difference. Number two, reach out. Talking to someone you trust about how you are feeling. Remember, seeking help is not a sign of weakness, it's a step towards healing. Number three, stay informed. Educate yourself about mental well being. Follow credible sources, read articles, and watch videos to better understand how you can support yourself and others. Mental well being is not a destination, it's a journey. We have to walk together. It's time to recognize that mental well being is just as important as physical health. Together, we can break the stigma and build a healthier, happier, and wealthy India. If you found this video helpful, Give it a thumbs up, share it with your family and friends, and subscribe to our channel. Let's make mental well-being a priority, one conversation at a time. With that said, I will see you in the next video. Thank you for watching the video till last. Signing off, Samesh Haspan.